Hi everyone, we are group 20. Our campaign is called Pass on the Pipe. We are targeting university students and hoping to end hookah use. Our main goal for this intervention is to reduce hookah use among university students in San Diego. Pass on the Pipe aims to reduce the prevalence of hookah use among San Diego University students. We're partnering with the 3 schools in the area, San Diego State, UCSD, and USD, to provide education and shift attitudes on the use of hookah. The objectives of the study: the first one, by the end of the week-long campaign, 40% of participating university students from the 3 schools that we're partnering with, USD, SDSU, and UCSD, will be able to recognize and list the negative effects, long-term and short-term, of hookah use. Second objective, upon the completion of the week-long campaign, 1 in every 4 university students participating in the Pass on the Pipe tabling events will be able to locate community resources providing help with tobacco cessation. The third and final objective, after the campaign is over and the follow-up email goes out, all participating university students will show a 10% decrease in use of hookah and other tobacco products 1 month after Pass on the Pipe ends. The conceptual model. When trying to persuade change of conscious behavior, the theory of planned behavior has proven to be the most successful. This design applies to the Pass on the Pipe campaign because, like the theory, this intervention works to shift attitudes from accepting hookah use to completely eradicating it. Through education, this program hopes to change the way students view hookah and measure whether this attitude shift shows decreases in their use. So, our main outcome for this intervention: we want to increase the individual's knowledge on the negative health effects of hookah. We're planning on measuring this by our participant system. The students will be receiving a punch card that tracks the amount of education the participant received at the beginning of the intervention. A secondary impact that we would like from this intervention would be a decrease in the individual's use of other tobacco-related products. We are planning on measuring this by a pre- and post-test survey given to all the student participants. So as mentioned before, we plan on using a non-experimental pre- and post-test. This is being used because the program aims to reach as many students as possible, with the attitude that any exposure to the program will be more beneficial overall than secluding individuals in a control group. Because the intervention is a school-wide event, it would be nearly impossible to make sure the control group wasn't going to campus events and receiving the information, thus contaminating the results. We're also working with a limited budget, relying heavily on student aid. Administering pre- and post-test is the most cost-effective measure. So, our disadvantages here: because there's no control group, there's no way to filter out confounding factors, which of course affects the validity. But I must say, we do have a great advantage. Who doesn't love money and cheapness? This design is cheaper to produce and helps the program reach more students. What more could we ask